One of the duties of the Director of Public Health is to produce an annual report on the health of their population. As my first report as Director of Public Health in Torbay, I've chosen to focus on mental health. Mental health is one of our most important assets. For most of us, we exist in a spectrum. For most of us, there are days when we feel positive about life. We have a sense of control. We feel that there's a contribution that we can make. We feel supported by loving family and friends, by co-workers or fellow students if we're at school or college. We feel confident about life. But there are days, and most of us have experienced those days, when we feel so overwhelmed by the stresses and strains of life. For some people, that's because they're dealing with a chronic physical illness or maybe in pain. For some people, it's the uncertainty of employment or their housing security. Whatever the factors, it saps the energy. We don't feel that we can make that full contribution. We don't feel that we can change things around us. And hopefully for most of us, we spend most of our time having more good days than bad days. There are, however, a number of people who have mental illness. We don't fully understand the reasons why some people may have a diagnosed mental illness, but we know for many people there is a history of trauma. There's a history sometimes of abuse that takes place in early years. History of neglect sometimes, history of physical, emotional, and other forms of abuse may be the trigger that leads people to have a future diagnosis of mental illness. Whatever the causes of mental illness or mental ill health, we know that having supportive relationships, supportive workplaces, schools, and communities can make a huge difference. This report is about looking at the options that we can make for people to ensure that they can live a positive and thriving life, that they have supportive environments and relationships, whether they have a diagnosed mental illness or not. It also highlights some of the key challenges for us in the Bay, that we have very high rates comparable to other areas of self-harm, that we have self-harm in children and young people, that we have some of the highest suicide rates in the country. These are issues that we need to continue to tackle with a level of urgency to ensure that these negative outcomes are not the only options that people feel that they have when they're overwhelmed by the circumstances of life or of having a mental disorder that they're managing. We recognize that in order for each of us to have our best possible mental health, whether we have a diagnosed illness or not, takes more than just access to services. That is important, of course, and there's a lot that we need to do to improve our mental health services. But it is important also that we have supportive environments, supportive workplaces, supportive school environments, that we all have strong relationships that help us to be resilient against the stresses and strains of life. I hope that as you read this report, you will be stimulated to engage in a conversation about how you might work to improve your own mental health, but also the mental health of those around you. How we might work together to develop and maintain more supportive environments, more supportive communities, workplaces, schools that help people to be resilient, to help them to maximize their full potential and to thrive in Torbay. Do enjoy reading. Thank you.